You did mention some peculiar behaviors. We also noticed some of the mothers telling us that, doc, they are very particular in arranging their toys in a particular line, or they love the wheel of the toy. They keep spinning the wheel. What are these behaviors?
Again, related to your sense of balance. So these children are very vestibular. They keep rocking on their place.
Yes.
They like spinning things. They will just keep jumping from one place to another. So that is how their body reacts to the environment. They don't know. So they can be oversensitive to it, or they can be undersensitive. Some of them like to arrange things very in line,
perfectly,
in patterns. They're very concerned about hygiene. They'll keep washing their hands if slight dirt is there on their hands, and they will do it again. So that is the repetitiveness of their behavior. Again, it's a part of the spectrum.
Parents often go recognizing the speech delay because that's something obvious. I always tell them it's very important to first have an assessment. Can you throw some light on assessment?
So the problem is the parents recognize only the speech delay and they go for speech therapy. What we need to understand how the speech development happens. A 1-year-old can communicate without words as well, right? So just speech therapy is not an answer for autism. We need assessment to determine what is the problem of the child. Every child is different, and a lot of them are very overactive. They cannot sit in the one place. Then how do you expect them to learn and do speech therapy? So we need to have a baseline assessment where it is not for the parent or to label the child mild, moderate, severe. It changes over time, over the lifespan of child. A child who's labeled severe may not always be severe. A child who's labeled mild may be out of the spectrum after a few years. So since we know it is environmental and genetic, which we don't know, there are certain causes which are treatable. You tell me, if you have 1% chance of giving a child a pill and he gets better, wouldn't you take it?